Weston-super-Mare Hospital closed its doors on Monday due to a severe outbreak of COVID-19. Investigations are ongoing, but one theory behind the spread is an influx of visitors to the town drawn by recent good weather. And if we are fighting it on the beaches, that certainly suits the style chosen by the Health Secretary in launching the government's new test and trace system designed to address such outbreaks.
If you are contacted by NHS Test and Trace instructing you to isolate, you must. It is your civic duty. So you avoid unknowingly spreading the virus and you help to break the chain of transmission. This will be voluntary at first because we trust everyone to do the right thing. But we can quickly make it mandatory if that's what it takes.
Councils will be expected to apply local lockdowns to prevent outbreaks linked to virus hotspots. But health experts say given the scale of the task, local expertise in tracing outbreaks should have been recruited earlier.
There will be teething problems because we've never done anything on this scale before. And the good thing is now that local authorities are being supported. There's extra money going in to enable them to play their part in this process. But we should expect things to go wrong even as the plans are further developed because the ambition is huge. The logistics are very complex. The government is now beginning to get a grip, but it's done so very, very late in the day.
This is how test and trace will work in England. Anyone, even under fives, who have symptoms can get tested now. If you test positive, you'll be called by the NHS and tell the tracer about any close contacts, including anyone you've spent at least 15 minutes with within 2 metres proximity. Those contacts will get a phone call. If you have symptoms, you'll get a test, either at a mobile testing centre, a drive-through, or you'll be sent a test through the post. If you don't have symptoms, you'll be told to isolate for 14 days. And if pockets of infection are found, it could mean streets or areas are locked down. Today, the PM admitted to MPs it was a big ask, especially for those told to isolate for 14 days without a test.
It is a huge imposition, but it will be on a very small minority of the population, a very, very small minority of the population. And I would just say to everybody that it's worth it.
The new head of Test and Trace said they would be listening to the public.
This is a very large service that has its first full day of operation tomorrow. So there will be some kinks for sure, but we're committed to listening and learning to the user and citizen feedback to keep improving.
But will the public be sympathetic to Mr Hancock's tough talk following Dominic Cummings' excursions and the government's reactions to them?
So exiting lockdown is only going to work if everybody follows the test and trace rules that have been outlined very clearly today. But clearly all of us in the NHS are worried that the furore of the last 4 days has dented trust and confidence in the rules and those who set them.
Test and trace isn't a safety net. Even if the rules are followed, it might only reduce spread of the virus by 15%. But if we all do our part, it could be the difference between staying on top of COVID-19 or seeing a lethal second wave in the outbreak.